All right, members, welcome back to the second session. I'd like to welcome the 20-odd deputations. We had 25 deputations for the previous session who joined us to talk about the support for the carers. And we're working the administration very hard today. This is an issue that has extensive implications. We have a really overwhelming response. The deputations will be restricted to 3 minutes each, so please maximize the time available. Just a reminder that you will not be protected by the powers and privileges ordinance when you speak. So let's move on to the deputations before I invite the administration to respond. Hong Kong Evangelical Church Social Service Center, Mr. Wong Tin Yao. Chairman, thank you. I'm here to give a voice to the women who cannot come here today. Chairman, we are the grassroots women living in Shui. We are grassroots housewives. We are coming from different backgrounds, but we have to get up at the crack of dawn, looking after the kids and doing household chores every single day. There is no relief. We are working like 24/7, not even sick leave and so on. It is very difficult for us to relieve our pressure. Sometimes we would much rather to be hospitalized than to get away from it all. If our husbands are on leave at home, we'll have to look after an additional person. It is tremendously stressful mentally, and we are really going mad. And we sometimes we have to rely on the SSA for livelihood, but the procedures for application is so complicated, it would be difficult for us to make the application. It is against the law to leave our children unattended at home. We can't have a job on the side. We can't really shake off this poverty, not to mention any savings. Now, kids these days need a lot of extracurricular activities, and we cannot afford it. For those, we cannot compete with those who are more well off. We cannot really shake off the poverty-stricken life. It is not hard to understand why some are suffering from depression, and some are even bordering on being suicidal. In Fanling, there was an item of news of a pregnant woman who was trying to claim her life over an argument over a restaurant table. I hope that the government would give us due recognition. They should recognize our contribution to society. They have to spare a thought for our plight. Some suitable assistance should be offered to us. There should be allowance for the long-term full-time carers. There should be respite services. There should be childcare services. There should be better town planning. The land should be optimized according to needs. We should not build all that many car parks in the housing estate. There should be community halls. There should be community facilities to be built and lighten our load. Thank you.
Thank you, Mr. Wang. The Hong Kong Society for Rehabilitation Center on Research and Advocacy. Ms. Hong, please. We serve persons with disabilities and people with long-term illnesses, and as well as the elderly. We are happy that the government pays attention to the needs of the elderly and people with long-term illnesses and their carers. They face a lot of pressure. The carers face a lot of pressures, and the government has given them supports. Apart from elderly people, Hong Kong has a lot of people with long-term illnesses and PWDs. I hope the support service can be extended to the carers and the family members of these needy people. A lot of family members of these PWDs spend a lot of time to visit the doctor with them. Or young patients of Parkinson's disease, they spend a lot of transportation. Our recommendation is that in the carers allowance, they can include a subsidy on transportation. This would relieve the financial burden of the carers. And this would also relieve the burden of the society and promote efficient use of resources and also aid the rehab progress of these patients. We also have to pay attention to the mental conditions of these carers. Apart from time and efforts, they also need attention on their emotional needs. We conducted a research with the Chinese University last year. A lot of carers suffer from depression and anxiety, and over 40% suffer from depression or anxiety. A lot of family members are patients and carers themselves, and they suffer great stress. Their stress index is 9.9, while the full scale is 13. They suffer a lot of stress, and the family members of dementia patients also have very poor mental health. And 42% of the interviewed family members consider their own health conditions bad or very bad. And it's obvious that they need a lot of support. And on the other hand, the government should also help find jobs for them, because a lot of them still have working capabilities. And this would effectively help improve social capital. The government has set aside funds for training elderly carers. I hope such subsidy can be extended to rehab organizations, and I hope the government can provide greater support to PWDs and the elderly people. Association for the Rights of the Elderly, Dr. Lee Kamut. We hope the carers allowance can be implemented as soon as possible, especially and it's important to provide support to carers of the elderly people. And the allowance is a very important part of the supports. And this will help reduce reliance on public services by the elderly people. And countries like UK, US, and Canada have been implementing similar measures for years. Under the Aging in Place policy, we have to provide necessary support for these elderly people. And this is not a poverty alleviation measure. The allowance serves to appreciate, acknowledge the efforts of the elderly people, and compensate for their efforts. Apart from the allowance, the elderly people should still be qualified to apply for workplace homes, and there should also be subsidy, home care subsidy for the elderly people to buy necessary equipment or to make modifications at their homes. this is all part of a comprehensive support plan for the elderly people. That's all. And the Rehabilitation Alliance Hong Kong, Mr. Lau Kok Lam. Carers are a respectable job. The government should help relieve the emotional burden of these carers. In a joint committee, a lot of bodies raise suggestions on support to PWDs. For example, some facilities are too remote. We think the government should improve the existing facilities and services for PWDs, and for daycare centers and shelter workshops. They should be earmarked for long-term planning. And these facilities should provide a chance to train these PWDs and also give breathing space to their carers. And on the other hand, these facilities, these resident homes are a last resort, but in a lot of cases, the users have no choice. A lot of, at the moment, the waiting times for such homes are very long, and as a result, the carers have to continue to take care of their family members. Therefore, the government should try to reduce the waiting times of these facilities. We should also step up services for carers. Most rehab services are geared towards PWDs. Now, more and more organizations are providing services for carers, but it's still not enough. We want the government to step up services, carer-based services. Apart from training them on the necessary caring skills, they have to take care of the carers' personal development and needs. For example, social needs and emotional needs. At the same time, respite service for PWDs should be stepped up so that carers can make good use of the service and continue to have their own social lives. And with inadequate support to the resident homes, and a carers allowance should be set up to compensate for the lack of support services. And also a carers allowance should be set up to appreciate the carers' contributions to the society. Tin Shui Wai Carers Concern Group, Mr. Yun. We hope the government can implement carers allowance as soon as possible, so that the carers can receive protection and acknowledgement for their contributions to society. I want to share a story from Tin Shui Wai. Mrs. Chung has 3 kids. One of them is in primary school, one is a toddler, and one of them is a newborn. Now she's just counting on CSSA. Her husband does not have a full-time job. Every morning, Ms. Chung has to make breakfast for her kids, and at 7:30 she has to bring her kids to school. And after that, she has to buy foodstuffs at the market and prepare meals and take care of her baby. And afternoon, she has to deliver lunch to her kid. And after she comes back, she has to prepare dinner. And she also has to take care of the homework for her kids and until 10 p.m. And during the weekends, she has a full-time job of taking care of all the kids. She hardly has any personal time. And she has invested all her time on the 3 kids. And she's worried about their growth, about their lives, And at the same time, she's also worried about her husband, and she doesn't want to further increase his burden. And and her husband is working hard to make ends meet. Right now, Ms. Chung feels very helpless and shameful for not being able to contribute to the family. So try putting yourselves into Ms. Chung's shoes. What would you do in that situation? Other groups have shared their thoughts today. Carers have a full-time job at hand. It's round the clock. They are deprived of personal space and freedom. With Hong Kong transforming itself into a knowledge-based economy, a lot of the times families are the ones who suffer the most. And there's research which shows that if the full-time carers are paid, their annual salaries can amount to over $300,000. We hope the government can establish carers allowance as soon as possible to appreciate the dignity and to ensure protection for these carers. Thank you. Tin Shui Wai Community Development Network, Ms. Chung Yun-yi. Tin Shui Wai is a grassroots district. We have a lot of young families and a lot of elderly people in this district need help. There is great demand for carer service. I'm a housewife. I have 2 kids. My father has passed away in the last 10 years or so. The responsibility of taking care of the 3 kids fall into my hands and my mother's hands. The government is always thinking about financial efficiency. If you do not implement social measures, all the responsibilities fall into the hands of the mothers, and over 80% of them, of the carers, are women. Yes, it's the family care is priceless. We work 365 days a year. The government would not count our contributions in its GDP. When we request social services, support services, the government is tells us that it has no money. I think this is a form of discrimination against women. I also had to take care of my father, and I'm a housewife who also needs to take care of my kids. My feeling is that I'm under great stress taking care of the elderly people and kids. It's a thankless task. We have no breathing space, no respite care services for the elderly, for children. We have nothing. When I was giving birth, I wanted to have someone in the district to provide respite service for my kids. Well, so what am I supposed to do? Am I supposed to bring my kids to the hospital as I deliver my baby? The government's policy is to use foreign helpers in place of policies. For people who cannot afford helpers, we are right at the very bottom of the social pyramid, and we have no social status. If we cannot take care of our kids, our elderly family members well, we are the ones who are under blame. The government is not providing adequate social service in the districts. It has been dragging on for decades. I really hope the government can enhance support services, caring services, and more support can be given to PWDs and carers of children to acknowledge our efforts. Thank you, Ms. Chang. Chang Kun O Care Group, Ms. Chang An Yip. I'm a representative from the Chang Kun O Elderly Rights Concern Group. The government has promoted the concept of aging in place, and it hopes the elderly people can live at home. And we hope setting up a carers allowance can encourage family members to and the elderly to stay at home, as well as reduce waiting times for elderly homes, as well as shortage of manpower in caring facilities. This would only benefit the government. Elderly carers are under great pressure. They are on call around the clock. They take care of the elderly people every minute, and their efforts have to be acknowledged. The elderly carers allowance is a recognition by the government, and it's also a form of civil rights. And so the allowance should not be means-tested. Elderly care is a long-term policy, and the government cannot consider it a pilot scheme. We hope the government should conduct long-term planning. Finally, we hope the elderly and PWDs, we think they face the same situation, and we should treat them the same. They should be cared for, and they should enjoy the allowance. I hope the government can extend the elderly carers allowance can be extended to all carers. Thank you, Ms. Chang. Hong Kong Elderly and Carers Rights Allowance, Mr. Lee. Thank you, Chairman, members. The carers allowance, elderly carers allowance, is a civil right. We can take reference from Austria. Different tiers of allowance are afforded to carers of PWDs. And the carers have the freedom to as to how to spend the allowance, and there's no restriction. The carers allowance should be implemented territory-wide. And should not be restricted to particular districts. And there's no conflicts. The allowance should be based on the needs of the elderly people. We oppose using the CCF to help these elderly people because it's a temporary fund. And it's time limited, and means testing is required. The government should have long-term planning on social welfare and consult the public. And the elderly carers allowance is a big part of the long-term plan. And the government should not consider it a pilot scheme.
唔該曬啊，李生。跟住請香港中國婦女會黃耀明女。
All right, next Hong Kong Chinese Women's Club, Ms. Anita Wong. Chairman, thank you. I like to speak on behalf of the Hong Kong Chinese Women's Club. We have 6 colleagues making their representations here today. Now, these back in the year 2000, we have set up a working group on long-term care, and we put forward this idea of carers allowance for the PWDs and the elderly. At the working group, we have been advocating that the government should formulate policies in this regard, but unfortunately, as of now, we haven't seen anything in this direction yet. And I urge the honourable members to urge the administration to get this achieved. We do have our position regarding long-term care. We believe that this is an entitlement on the part of the residents. As a caring and affluent society, the administration does have the obligation to provide long-term care for the needy. On this question of long-term care, my colleagues will be speaking on this in greater detail. There should be better support services, and if we'd like to highlight the inadequacies, the shortage in this regard, there should also be assistance in cash and assistance in kind. Now, we suggested that the carers allowance should be made available to recognize the efforts and contribution of the carers. This can, in a way, relieve their pressure. And my colleagues will come to that later. I like to mention the care service allowance. Over the past decade or so, the senior citizens have been waiting an awful long time for the care service. I mean, some of them would die waiting, and a lot of the senior citizens, given the choice, would not like to move into a home, and they would much rather stay at home to be looked after by their family members. So for a mildly impaired senior citizen, a home service would cost $7,300. I think it would be far better for the amount of money to be dispersed to the family members who are looking after this person. That way, he would give up the chance of moving into a home, and that would shorten the queue for the elderly homes. Now, with this amount of money, the family members can spend flexibly on transportation, on home care, on domestic helper, and so on. Basically, if they do have some professional expertise, then they can become a service provider, just like the voucher system. The NGOs are the service providers. Likewise, I would like the family members to become service providers as well. I'll be quick. And there should be a system of care managers. Finally, we understand that the CCF and the Elderly Commission are also looking at this idea of carers allowance, and I hope the two bodies can engage the public for some public consultation. All right, moving on next to Mr. Ng Ting Shan, Care for the Elderly Association Limited. Chairman, thank you. I speak on behalf of the HKCSS. In order to support the carers, the government should fine-tune the services for the homes for the elderly. There are a couple of suggestions I would like to make. In these nursing homes, they have admitted a lot of elderly who need healthcare service. And the ratio is something like 60-40. 60% would require care and retention homes, 40% would require nursing homes. In order to make sure that they get the nursing care, we have to upgrade the services we propose. The more resources be devoted to the nursing homes. Depending on the state of health of the senior citizens, we can increase the ratio so that they get long-term care. So that if the state of health deteriorates, the family members don't have to be transferred to the nursing homes. Secondly, we have to adjust the priority for the waiting list. If an elderly has been deemed to be in need of care and attention, then he should not be confined to the community care alone. These old and infirm elderly without any carer support, they should be given care and attention homes. So these people should be given a higher priority. We propose that these be implemented as soon as possible. These would better support the senior citizens in the community. Thank you. All right, moving on to the Hong Kong SKH Lady Macleay Ho Centre, Mr. Benson. Chairman, I am speaking on behalf of HKCSS that the community care service covers the district community centres and the neighbourhood elderly centres. We have, of course, we have to show concerns for the carers, and I'd like to highlight the social workers who are looking after the carers. The HKCS has conducted a survey all over Hong Kong. We covered 41 district elderly community centres to ascertain the workload. Between February 2011 and 2012, 19,000 cases have been handled. 37% or 4,000 or so cases have to do with the elderly. Now, for these cases, they don't. Files don't have to be made out for them. These are potential cases, and they're not NEC cases. So in the community, the demand for elderly care is enormous. Now, if you look at the CCS voucher scheme, or for that matter, any other services, and they would. The district elderly community centres and the neighbourhood elderly centres will be doing the management. District councillors or electoral members will refer these cases to the elderly centres for support and for follow-up. So we're faced with an ever-rising burden. As I said, 37% would require elderly support and 33% have to do with mental health. Now, 3,000 odd of the 3,000 odd cases, 2,000 of them are suffering from dementia. Now, for these demented patients, they do need day-to-day care, and it is very much a burden for the carers. The carers have to approach the social workers for assistance. Now, from the time they need a home to the time assessment is conducted on them. Now, when they have to do a lot of work, and these demented elderly do have a lot of worries, and they need social worker support. And the workers are really having a crushing workload. So we propose that the SWT and other departments might consider increasing the manpower for the elderly centres for them to handle this ever-rising backlog of cases. Thank you. All right, Mr. Yip Wing from the Labour Party. Chairman, according to 2009 statistics, 36,000 PWDs and 1.5 million chronically ill patients. The Labour Party believes that the carers looking after these people cannot hold down a full-time job. We must recognize that the carers are holding down a full-time job. It is true that the family members have to look after their family. They have to provide a mutual support, but we do have to recognize the contribution made by the carers themselves. In Australia, Ireland, the UK, they do have carers allowance for singletons and for spouses, and some of them are means tested. They range between $1,600 and $16,000. In Hong Kong, we're running short of homes. There are many who choose to live in the community, and they do need family support. It is pretty expensive to hire foreign domestic helpers and also private nurses. The carers simply cannot leave their job for any length of time unless they are sufficiently well off. We have cases in which the respite services have a really long queue for a couple of months. It is only when they cannot cope that they would require the respite services. But I mean, there is no one they can turn to. In Hong Kong, we keep saying that we're running short of land, and we have a lot of new applications. I mean, nothing seems to be achieved. They have to look after the disabled or elderly people 24/7, and this is creating a heavy burden on them. And we are suffering from the aging population in Hong Kong. I think the government should offer urgent, immediate assistance to these people. Now we are we're donating $100 million to the mainland, but we are running out of resources for the carers. So I think that it is important for the carers to be assisted financially so that they can put food on the table. All right, Ms. Maggie Chiu, Baptist Oi Kwan Social Service. Chairman, I'd like to say something regarding the carers. I would like to highlight the dementia cases, and I would like to make the following recommendations. First of all, for those who are suffering from dementia, we should equip them with the right knowledge and expertise, and these should be made a regular service for them. There should also be psychological and emotional support. There should be a toolkit to be made available. At the front line, we encounter a lot of service users who are approaching us with inquiries about where they can turn to for help. And I think that these kind of service will help the carers when they are looking after the patients, and they would get handy information. And also for non-drug support, like home facilities, there can be some assistance rendered to them. For the needy families, for instance, we understand that the home situation need modifications to a certain extent. If some assistance can be rendered to them, it would be a good idea. Policy-wise, there should be long-term planning in terms of the design of the homes for the elderly, and that there should be proper guidelines to be formulated. We are anxious that information should be disseminated properly, that there should be more transparency in the availability of information, there should be a district information to be made available to the district people. All these would help the senior citizens and the family members to plan ahead for themselves. It's just like the waiting time. At the present moment, we have a centralized waiting time for the homes, but for district care services, we don't have that much in the way of information. Perhaps there should be more district information about the waiting time for the CCS. This would enable the carers to log on the web to browse for information about the waiting time. The district councillors can also get hold of the waiting time for a particular district. When they are planning the district services, and they would be in a position to get more data. Finally, I'd like to say that the HKCSS has the action plan for dementia. These are practical information kit for the members of the public.
Thank you, Mr. Chiu. Salvation Army Yao Chim Integrated Service for Senior Citizens, Mr. Bitmus Siok. Thank you. Today I speak on behalf of the HKCSS committee. I want to talk about the support facilities for elderly carers. A lot of the elderly hope to receive care services at home or care centers. If we enhance support for carers allowance, this is a win-win situation for both the elderly and the society. Right now, a lot of people take for granted the contributions of the carers, but in fact, their work needs to be acknowledged. A lot of the carers are very young, and they need to reduce their working hours, or even change to another job, or even quit their job to take care of their families. This would have a lot of impacts on their social lives and standard of living. And we feel the government should provide carers allowance to acknowledge their efforts. Just now, Mr. Tam Yu Chong said the carers have a lot of expenditure, for example, making modifications at home or purchase wheelchairs. In this front, the government should provide allowance for carers' expenditure, and this would also encourage family members to fulfill their responsibilities. As some of the groups have mentioned, these measures should not be categorized under the Community Care Fund, but they should be permanent measures, and they should be popularized to the entire Hong Kong. And the amounts of subsidy given should depend on the level of need of the elderly people. Other financial assistance include parents' care subsidy, or increasing the tax allowance, and allowance should also be given so that carers can purchase respite service from time to time. Thank you, Mr. Chiu. This is Grace Chan from HKCSS. We want to enhance some support services, and we want to implement a case study mechanism. We want to give more support to elderly carers. And we also want to offer counseling service without having to refer them to other organizations. Right now, also, the support services are inflexible and they are not integrated well enough. And for instance, the enhanced home care service, the recipients cannot receive other community center services. And there's a lot of inconvenience to the family members. And second, the case study mechanism. Some people may need a lot of social community services. For example, daycare centers, elderly centers, or support services for discharged patients. A lot of the services are very similar to one another, but there is a lack of consistency among different government departments, and these services are all provided through different departments, and this creates confusion for the users as well as institutes who want to help the elderly people. And the standards of applications are also very different. And it's difficult to monitor the health conditions of the elderly people and whether they have improved. And that's why we want to introduce a system for following up different cases, and we can keep files of the different needy people, the elderly people, so we can provide consistent care services for these elderly. Thank you, Ms. Chen. Next, Carers Rights Concern Group. Ms. Chen, we have 3 points. First, children's carers and family-friendly labor policy. For mothers, a lot of them do not have holidays subsidies, and children needs their mother's help. And as a result, their mothers have to give up their jobs, their personal hobbies, and without the mother's income, a great financial burden is created for the entire family. And so this is a wonderful efforts by the mothers, and the government should recognize their efforts. Children are pillars of Hong Kong's future. And so we hope the government can set up a children's carers allowance. And we also have to step up childcare services. Hong Kong is well behind other countries in this respect. We have inadequate services. They are too expensive. Scope is very limited. A lot of families can face emergency situations, and they often have to bring their kids to the hospital, etc., because of a lack of childcare services. And for mothers cannot even afford to get sick. I hope the government can recognize our difficulties, and the government should provide quality child care services to help mothers. And third, family-friendly labor policies. A lot of children have holidays, school holidays, and working mothers find it hard to give time to their children. They hope to spend more time with their children. Hong Kong's policy do not care about the carers of children, and labor policy is also behind, and I hope the government can make further studies on this. Tin Shui Wai Carers Rights Group, Mr. Chen Wai-lun, on the carers policies. I think we have heard a lot of opinion from people who are suffering from the situation. And I don't wish to repeat such points again. However, I want to talk about the government's support policies. I think there are fundamental flaws in the government's views on carers policies. If we don't correct it, I don't see any improvements possible in the future. Just now, the government officials responded to some of our calls. They have provided respite service, community care services. However, these measures can never catch up with the demands because they are not long-term solutions. The demand will always be greater than the services provided, and this problem has persisted for a decade or so. Right now, the government is not gender sensitive. For instance, for transport subsidy, low-income workers have transport subsidies, but the carers do not have transport subsidy. Very often, they have to accompany their children, their family members, to buy different equipment. And right now, the carers don't have any transport allowance. In terms of policy, they have not catered for the carers. And carers would not have retirement benefits like MPF. The government can do a lot more. And from the news, you might have known that the government has submitted documents to EXCO, and I hope the government can take into account the carers' feelings in the future when establishing its policies. The government always emphasizes family responsibility, and it doesn't. It never talks about the government's duties. Well, in its advertisements, the government always urges the public to be gender sensitive, but the fact is, the government is delegating all its responsibilities to the carers, and it's dodging its duties while asking the public to take up their own responsibilities. And another problem is that the government has no planning. When we talk about elderly carers allowance, if you group it under CCF, it's the CCF is for poverty alleviation. I think the government is just trying to dodge its responsibility, and there's no long-term planning whatsoever. If we do not rectify these problems, we can have meetings all year long, and the problem of elderly care can never be solved. Mr. Zico Man from Civic Party. I'm speaking on behalf of Civic Party. The government has a slogan. The carers are central to their families, and now the government never recognized the roles of the importance of these carers. At that time, the government did not have enough elderly homes, and the elderly had to wait for 36 months before they can be admitted. And for PWDs, they have to wait for 7 years before they can enter such care homes. For private service, resident service providers, they most often they cannot meet the requirements of the SWD, and a lot of elderly people are treated very badly, and their families are reluctant to send them to the care homes. The government does not have enough support services, and in the government's concept of aging in place, capable people are doing a lot more. and there's great financial burden placed on healthy family members, and this contributes to family problems, family breakups, and this leads to even more elderly people who have to live alone, and this creates social problems. The government must improve community care services and step up support for carers. Right now, a lot of elderly people and PWDs have a $2 allowance transportation subsidy, and this should be extended to carers so they can help their family members. And this also means that the government does not have to increase capacity for community elderly care services. A lot of full-time carers give up their full-time jobs to take care of their families. Right now, we do not have a universal retirement protection scheme, and the carers' contributions, despite giving their all for their families, when they get old, eventually they would become burdens to their families in turn. So the government should provide remuneration or benefits to the carers, to the full-time carers, as a sign of acknowledgement. Another problem is that carers need to have certain skills to take care of their family members, and they should have a chance to be trained on these skills. Fourth, please speed up. This is my final point. And modifications needs to their homes require professional help. And the carers are the ones who know what's needed. The government should take in their suggestions.
Next, Elderly Policy Alliance, Mr. Tong Sin-cheng. Chairman, thank you. I am from the Elderly Policy Alliance, Tong Sin-cheng. We've been talking about this issue for so many years, and a lot of views and aspirations have been expressed. I don't propose to be verbose. I'd just like to share with you my personal experience. I must say that I'm not a carer myself, but everyone has elderly parents. One day, my folks used to be very healthy in those days, and they could fend for themselves. There were no problems at all. They were living apart, separate from us. So we did treasure the private life, but as they got on in years, they suffered from all these problems, and they lost their memory as the years went by. They were suffering from dementia and Alzheimer. There were signs of these. I didn't realize that. We only felt that they were making trouble for us. And everyone was feeling so bad because of this. A couple of years ago, my parents passed away, 97, 95, pretty old age. But as the saying goes, children don't get filial when the parents have long life, and it would not be all that bad for an outsider, and people pontificate at us and and lectured us as to how we should lead our lives. Now, for the full-time carers, their life is a million times tougher than mine. Some have to quit their job to be carers. It would be difficult for us to work out the value. There is no minimum wage. There is no standard working hours. And now they're talking about the carers allowance. And this is no big favor bestowed on them. The government has been encouraging elderly people to age in place. So the carers are doing the government a great deal of favor. But I'd just like to say one thing. The carers are human beings themselves. They're not machines. They're working so hard. If they work 24/7, then after so many years, they do need carers themselves. So I hope that in order to help the carers, the government will be able to achieve this idea of aging in place. Mr. Lord Tatman from the Elderly Center in Taiwan. Chairman, I am Lord Tatman from the Elderly Center. I am speaking in support of the carers allowance. Hong Kong is suffering from an aging population, and there are so many people who have to give up the full-time job in order to look after their elderly parents, and the community should recognize their contribution. A cash allowance would offer them a bit of protection, so we support this allowance for the carers. Second, this should be implemented in areas where there is no CCS voucher scheme, which will come into being in 8 districts in September. For the 10 districts without the CCS voucher scheme, this carers allowance should be implemented so that there will be no overlapping. The households, the same household, will not enjoy any double benefits. And this will benefit a lot more families. Third, we should cover the old and infirm elderly people. They should be assessed to be severely or mildly impaired. Elderly people are living longer and longer. The size of the elderly population is ever larger, so we have to put a cap on the applicants to cover only those who are in need. Fourth, this should not be spent on subsidizing the hiring of foreign domestic helpers. There will be certain difficulties defining the eligibility, but I don't think this should be allowed to be used on foreign domestic helpers. This should be restricted to family members because only they would be in a position to tell what the patient's needs are. The SWT should conduct random check to prevent any abuse. There should be clear eligibility criteria. When random checks are conducted, the SWT should check whether the beneficiaries are fulfilling their responsibilities. The carers do need to have specific expertise, and there should be training courses like the first aid courses should be offered to them, and also the caring capacity should be enhanced. Seventh, there should be support services, and the carers looking after the infirm elderly would need to provide intimate care, and there should be support centers that offer respite service for the carers. Mr. Law, and the procedure should be simplified for application. Why don't you make available your submission to us? Right, next, Caritas Elderly Alliance, Mr. Feng Heng. Chairman, thank you. We have the following comments to make regarding the carers allowance and support. First of all, the government has not attached sufficient importance to the carers' needs. In the policy address, it is completely silent on any measures. The carers, whether the carers will get assistance will make a difference to whether the elderly people will need a home for themselves. We should consider the feasibility of carers allowance so that the senior citizens can age in place. The Caritas Alliance is in support of the allowance. The carers are playing a significant role. Many carers have to look after the senior citizens on a long-term basis, and they give up their job, they give up the social life, and they face tremendous pressure. They suffer from depression, some degree of anxieties, and so on. It would be more flexible for community services to be made available to them. Third, the consultation should be a bottom-up approach. Before formulating the policies, in order to make sure the policies tie in with the actual needs, that there should be a public engagement exercise to solicit public views. Like the CCS voucher scheme and the OALA, in absence of any extensive consultation on the senior citizens, the policies are divorced from the needs of the senior citizens. This gave rise to so much controversy, misunderstanding, and confusion. Finally, given the aging population, the government should formulate policies on the elderly. The policy address that devoted very limited coverage to the elderly, merely the aging in place, the community care, and so on. All these are cliches, and we heard a lot about them over the years. The members of the public are very disappointed. Given the aging population, there should be more resources devoted to improving the long-term benefits. There should be a long-term elderly policy, and this admits of no more delays. Thank you. Right, moving on to the Elderly Council of the Hong Kong Christian Service, Ms. Wong Lian Kwan. Aging in place is the core of the government elderly policy, but over the years there have not been enough resources devoted to it. Many senior citizens would choose the old folks' homes, and because of the financial stringency, the carers are working under tremendous pressure. In terms of respite service, the daycare centers, over the years, there is not enough quota. The carers cannot get any relief. A lot of the carers are spouses or elderly spouses themselves, and they're getting on in years. They do need caring themselves. If rehab buses can be provided, then it would make it easier for the senior citizens to get out and about. The WHO advocates the support services for the elderly, but in Hong Kong we haven't seen any specific measures to follow up on this. the carers cannot live any comfortable life, and the Elderly Council is very concerned about the carers' allowance. This has been talked about a lot in the community, and a lot of views have been expressed to the government for well over a decade. I'm wondering why the government is really sitting idly by. Now, the government is proposing this idea of money following the individuals. I think the carers allowance can adopt a similar model. The provision of training for the carers is important. The sufferers have different degrees of impairment, and we should adopt a foreign domestic helpers pay as the benchmark, and we have to make sure that the carers would be able to look after the senior citizens. Now, the carers need to look after the senior citizens on a long-term basis, and they should be entitled to the allowance. Only then will aging in place be developed so that they can live with their families for the rest of their life.
Hong Kong Federation of Handicapped Youth, Mr. Leung Wai-kin. Most of our members are handicapped people, and they're very concerned on the pressures faced by handicapped people. We support the government's measures to help relieve their pressures. We have 3 suggestions. First, enhance the promotion of support centers for the handicapped. And the SWD has 16 support centers, but we recognize that a lot of people do not know about these centers, especially the newly handicapped people. So we suggest the government step up its promotions for the support centers, and to allow more people to enjoy the support services. And right now, the zoning of the support centers have not taken actual considerations into consideration. For example, the outlying islands users have to go to the Hong Kong Island support centers. So this caused a lot of inconvenience. And hopefully, the government can inject more resources and help the disabled people. And second is enhancing the childcare services for disabled children. A lot of parents are working and they do not have the ability to take care of their children all day long. So the childcare services are much needed. In Hong Kong, childcare services are commonly inadequate, and the waiting times are getting longer and longer. In 2007-08, the average waiting time was 12 months, but by 2011-12, the time has increased to 16.8 months, and we hope the government can increase the number of places for childcare services to alleviate the parents' pressures. And the third suggestion is to provide quick and prompt support services for carers. The carers sometimes get sick, and sometimes they have to go home. And there are a number of reasons when they cannot provide care for their family members, for their disabled family members. Right now, the current support services require advance booking, and they cannot respond to the emergent need of some of the carers. So we suggest the government can put in more resources so that the organizations, the bodies can make swift applications for support services. And the government can also consider increasing the respite places for emergency purposes for people in need. The Democratic Party, Ms. Chen Chiu-hung. Thank you, Chairman. The government agreed to, we propose universal carers allowance, and we want to extend the allowance to carers of all types of people. Over 80% of the carers are women. The carers allowance serve to acknowledge the efforts of the carers themselves, and what they are doing is highly valuable. They have sacrificed their own career opportunities, their personal lives, and this also encourage home-based caring and relieve the pressure on the provision of care centers. This allowance will promote social harmony and family harmony. As many of us have already mentioned, the carers need a lot of support themselves. The allowance can give a lot of help in encouraging the carers to take up more training, and they can form support groups so they can focus on their jobs at hand, which is to take care of their families. For mothers, the allowance can enable them to focus their time and efforts on their children and babies. I'm very sure that the carers would spend the allowance back on their family, for example, on social activities, on dining outs, on transportation, and they can also use this allowance to purchase short-term services. For example, respite services, daycare centers, short-term resident services, so the carers themselves can take a break. The carers allowance can relieve the waiting times for care centers. However, it doesn't mean that there isn't a need to build more care centers like this to alleviate waiting times on the long run. The carers themselves will get old, and they cannot take care of their families forever. So these care centers, these care homes are needed. And I hope the government can implement family-friendly labor policies. A lot of the carers have to go to work or have temporary jobs. Standard working hours, flexible working hours, additional holidays. These are some things the government can do. Thank you, Ms. Chen. Finally, the Hong Kong Association for Parents of Persons with Physical Disabilities, Mrs. Chiu-hung. Right now in Hong Kong, dementia patients amounts to over 100,000 patients. Dementia patients have faced a different situation as elderly people in general. Dementia patients will lose their abilities of their mental capabilities step by step, and their situations would often get worse. Sometimes the patients would blame themselves or suspect themselves, and their negative emotions can build up. Sometimes they see illusions, and later stage patients require round-the-clock care. We support the principle of aging in place. However, we must provide social support services for dementia patients. For example, respite services, training programs. These services can maintain the living standards of dementia patients, so that they do not need to go into institutions too early, and provide carers breathing space and this allows patients to stay at home and realize this principle of aging in place, family members have to spend extra money on things like hiring helpers. This puts financial burden on these carers. I hope the government can provide greater support and financial aid on these carers to alleviate their burdens and to complement existing social care services. And I hope the government can help dementia patients who are under 65 and provide supports for the carers. We think the carers allowance should not have an age cap. The allowance should help the dementia patients and their carers. Right now, I have taken care of my mother for over 30 years. She is 89 this year. But still, I hope to take care of my mother to my best ability so my mother can enjoy her remaining years happily. Right now, our official session should end by 2:15. I apologize for my lack of time limit. So may I suggest an extension by 2 minutes to around 2:17 p.m. But before further questions are taken in, I hope the administration can respond to all the suggestions in response to the questions of this session as well as the first session on questions on support given to working women. I hope the Labor and Welfare Bureau can respond. And in particular, the problem of dementia. Dementia patients have very specific needs. However, at the moment, we do not have very specific services for these patients. And overall, there is a lack of a consistent long-term planning for the carers for carer supports. And right now we have family-based support schemes like CSSA. These might actually be causes for family breakups, and the carers' mental and physical conditions have to be taken care of. The government has not raised any information and statistics. Earlier, the Commissioner for Rehab said these are under consideration. So can you say something about these? And so to facilitate further discussions.
Mrs. Chen, thank you so much for the invaluable comments. I'm really pleased to hear that the deputations agree with the idea of aging in place for the elderly. It's just that there are inadequacies with regard to the community care, and we're aware of that. Other than increasing the conventional services, we are introducing new ideas like the CCS voucher scheme come September. We are also contemplating the idea of a carer's allowance. Society is progressing. Elderly people's conditions are also different from those in the past. So we are contemplating new ideas. Now we are working on the ideas. So bear with us a bit here. Now, if the services are good enough, then the elderly people chances of getting hospitalized can be delayed. There are some elderly people who do need to have homes, and every single year we devote our resources. From now to 2015 to 16, there will be 1,200 places to be made available. There will be 8 projects in which new homes will be built. And these are the figures that we have at the moment, but nothing is cast in concrete. We will identify sites for homes to be built. We will be buying places from the private homes to boost the supply. The chairman also made a point a moment ago about the dementia and the services there. In fact, on different occasions, well, in fact, today, I've seen some of the friends that we saw before, and we would like to have the integrated service model going forward. Now, for the dementia sufferers and the carers, we should not lose sight of their needs. So, in our home services or community services, there will be resources to be made available to the practitioners to provide specific services for the dementia sufferers and carers. Now, of course, we are concerned about the carer allowance. As I said at the very beginning, we don't have any final version yet. Now, from what I heard today, I get a feeling that we have to think really carefully about it. Now, who should be eligible? Should there be means test? How much should we disperse? Should there be any strings attached and so on? There are diverse views. Now, we've heard what you have to say. We will mull over these ideas in greater detail. Well, a lot of the questions remain unanswered. A lot of the concerns remain unaddressed, but we're running out of time. Let's move on to Ms. Helena Wong. Mr. Leung Kwok-hung and Vice Chairman. 3 minutes each, please. Ms. Wong. Chairman, thank you. Well, due to the time constraint, I probably cannot move any motion today. Now, perhaps I leave it till next time. Now, this motion, in fact, is urging the administration to recognize the value of their productivity, the productivity of the carers, and there should be allowance made available to them. I'm grateful to all these deputations today. I am concerned about the needs of the carers myself. In this welfare system in Hong Kong, this is really a missing link. Now, we thought previously that it would be for the family members to look after their needy members. It's got nothing to do with administration. Now, for children, disabled, elderly, we don't have good enough respite services, and you're proposing, you're advocating aging in place in absence of adequate services. I mean, you're passing the buck to the family members themselves. Like this lady said, she's been looking after her mother for 3 decades, and it is only now that she's speaking up. I think the government should act now. They have given up on their time, they've given up on their work, they've given up on their social life, their pay, their remuneration. All these come with a price tag. The government should act swiftly. I'm glad to see that the CCF is having a pilot scheme for the carers allowance, but they wouldn't like to see this as a poverty alleviation measure. It should be part of the elderly policy as a whole. So I hope that the administration would give us a response as to whether they would be acting more swiftly. Now, you said, the administration said that we should give them a little bit more time. So other than elderly, what about those looking after the disabled family members, the children? and for this they cannot hold down a full-time job, would you offer any allowance to them? There are some family members who suffer from dementia, and it's impossible for them to hold down a full-time job. They have to look after them 24/7. Would you consider offering them some kind of allowance? Mrs. Chen. Chairman, thank you. Thanks very much, Madam Wong. Well, in terms of support for the carers, we're doing. We are working on this. We're providing service. As to whether this is sufficient is quite another matter. We will work hard on this. As regards carers allowance, and this is a first in Hong Kong. I mean, in overseas jurisdictions, they have this implemented, but this cannot necessarily be replicated in Hong Kong. So we will look at the details. As the Commissioner said, we keep our options open. I'm sure that members should give us a little bit more time. I omitted one point about the childcare service. This is not within our portfolio, but I mean we would go away with this idea and convey the idea to the relevant colleagues, and we can make available information if need be. Mr. Leung Kwok-hung. Chairman, the government employs the CCF to plug the gaps. You've admitted that this has fallen through the gap. Now the carers allowance may be pretty low, and this is not on. You may rely on the CCF to disperse the funding, and you're doing a really lousy job, and you're sitting on a lot of money. What are you going to do with it? Well, the carers allowance hasn't quite started. They don't even have a timetable. They said they keep the options open. We are concerned how much longer they will be stalling on the matter. They said that the CCF would do it. Well, how much funding are you going to have for this? Nothing will get done without any funding. You must have some ideas. And the projection? Mrs. Chen. Well, the Community Care Fund has its own funding as to how much are they going to be dispersing. As I said, each carer, how much should we make available? We haven't quite started the discussion. And this, if you start talking about the coverage of the pilot, then it's premature, Mr. Leung. Well, this is the money that should not be distributed. I understand that the CCF would like to have some money dispersed, and how much is it going to be? This would take up a small proportion of the CCF. Well, Chairman, I'm afraid I cannot be specific about how much funding has been set aside by the CCF. Mr. Leung. Well, the government cannot achieve anything at all. Now, the poverty alleviation task group is another body altogether. Now, there are three different bodies responsible for that. How are you going to handle that, Mrs. Chen? I wouldn't object to Mr. Leung's statement that we have three different bodies or entities are responsible for that. But in terms of carers allowance, we're working in collaboration. It is the CCF task force under the Poverty Commission that is taking the lead. It is the CCF that is dispersing the funding. We'll work out how this is going to work. The carers allowance will tie in with the policy of aging in place, and this is what we are intending to do. As to the specifics, I'm afraid I don't have any information. Where if you wash a shirt 3 times, it doesn't make it any cleaner. And I think effectively you'll be like cleaning the same shirt three times. There are 3 different entities responsible for that. How can you maintain the communication? I find that this is really stingy. Well, they haven't started talking about the funding or the coverage, let alone the funding. Now you have the handicapped, the children. Now for a small portion like this, you have 3 different entities looking after this. I think it is effectively a waste of time. If you're minded to do it, get on with it. Maybe at the end of the day it is Carrie Lam who will be doing it. It is a waste of time. I mean, I think this sounds really horrific. Vice Chairman. Chairman, thank you. Well, Mrs. Chen said that they are moving in the direction of aging in place. She admitted to some inadequacies there. Now, what is the ideal situation that you have in mind in the coming 4 years, or what kind of objectives do you seek to achieve in relation to aging in place? There are some deputations who made some concrete suggestions, like the funding that would otherwise be incurred for a place in the elderly home can be made available in cash to the carers. Maybe a few $1,000s can be dispersed to a family for them to look after the elderly, and for them to give up the old folks home place. Mrs. Chen. Well, the question of aging in place, and what we are keen to achieve is that if the elderly people would like to live out their lives at home, that would be a good idea. What we find inadequate is that despite our effort to increase the number of home places, the number of elderly is also creeping up. So other than the conventional services for which we devote resources, that we are looking at new ideas. At the present moment, in terms of community services, the frontline staff would agree that we are relying basically on subvented services. We'd like to have a more diversified market. We'd like to provide services in a more flexible manner so that the senior citizens can harness or can use the services in a flexible manner. We have finite resources. We should devote the resources to those who are in need, those who are from underprivileged background, those who are infirm, of those who can afford the services. Then we have a joint responsibility whereby the government services can be targeted at those who are in need. Now, looking ahead, while subventing the conventional services, we're contemplating new services. And we also have some new ideas like the CCS voucher scheme. Or is it going to help us achieve aging in place? Now, this is something that we are also looking at. You mentioned the manpower for the RCHEs. Previously, on different occasions here in LegCo, we did discuss this, the training for the professionals, nurses, physiotherapists, occupational therapists, and so on. We do have training for them. What about the district centers? Well, we heard what the frontline practitioners had to say. Now, indeed, we have increased the services for them. We will liaise with the Social Welfare Department. We are aware of the situation. We will offer as much assistance as possible where resources permit.
Today we have discuss the issue for 4 hours on the support and allowance to carers. And we see that a lot of improvements are needed in terms of support to carers. And on the elderly carers allowance, Mrs. Chan said our opinions are divided, but I can see a direction, and we can observe a few agreements. And one is that we agree that the carers allowance should be extended to children's carers. And in some cases, the carers have to take care of multiple family members. And the second point is that the allowance and the amount of services should not be opposing to each other, and we should have both. In fact, right now we do not have a timetable yet. The CCF has a fund of more than $100 million. Right now, the carers are facing great pressure every minute of their lives. So I hope we can get things done as soon as possible. I also hope for a public consultation, and the government should have its own view before consulting the public and come up with a timetable and action plan. And on the social care vouchers, how would you implement the program? It will be launched in September. Right now, there should already be some arrangements in place, but we need details on how to implement the scheme. If everyone agrees, next time I want to host a meeting to discuss specifically on the vouchers. I'm sure a lot of members of the trade and organizations would have something to say about this. And before you can provide further social services, the vouchers might be a temporary answer. And it's also an important part of this community care policy. So next time, in the next meeting, we can discuss further about the SEC vouchers. Thank you, everyone, today, and the relevant government officials for the 4 hours of time. And let's talk about the vouchers next time. So that's all for the meeting today. Chairman, sorry, I have a small request. Our next meetings at the end of June and early July are very close to each other. And we have 2 meetings very close to each other. If we only decide on the topic of the July meeting after the end of the June meeting, we might not have enough time to prepare. So I hope it can be decided today. More information can be given today.